Welcome to A Minute with Marty. Hope you're having a good day. A quick topic today. 8 tips if you're changing your health insurance carrier. Sometimes you have to do that. As rates go up and all those good things, and you need to change your carrier. So what are some things you need to keep in mind? The first one is make sure you don't have a doctor's appointment on the day that your new insurance takes effect. And I know things happen, but sometimes, carriers don't get you information in on time. Depending on when it was submitted, it may not be active on the first or second day that it's supposed to be effective. And the worst thing is to get in a doctor's office and they're calling and you're not in the system. So schedule those things out if you know you're changing your insurance carrier. Second thing is give your doctor's office or your pharmacy your new card information. Show them the card. Give them this card. Because it never fails. We always get those calls shortly after a new policy becomes effective. They say I'm not active. They called, all that good stuff. Well, what happens is, especially a pharmacy, if they submit it and the old card coverage is terminated, it's going to flag it. If the new coverage information is not in there, it's going to deny it. And a lot of times we get those calls, we call the pharmacy, and guess what? They still have the old information in there, even though you gave them the card. So make sure they make that change. The third one is make sure you fill your prescriptions early. When you know your other policy is about to end, make sure you fill those prescriptions. If you're going to fill it earlier, do that. Because again, it goes back to if you're not loaded in the system when it changes over, you want to give that new carrier some time, first few days, a week or so into the new policy year, and make sure everything is in the systems. Depending on how large this carrier is, there's just a lot of different systems. So make sure you fill those medications before the new policy becomes effective. The fourth one is review your plan. It never fails. Somebody will say, well, my other plan didn't do that. Well, you need to make sure you review your policy. When you're changing, know what's happening. The copays are going up, prescription copays are going up, deductible goes up, out of pockets, all those things. Make sure you review your new plan. The fifth thing, verify that your doctors are in the network. The worst thing to find out your doctor's not in the network is when you need some services. So take the time prior to make sure your doctors are in that network. The sixth thing here is find the nearest in-network urgent care. And you say, Marty, why do you do that? Well, your doctor's office can close at 5. The thing we've seen the most is you can't get in today. You're sick. You need to see somebody. So if it's an in-network urgent care, a lot of times they open later on in the evening. Sometimes on the weekends, you can go in, see them. It's nothing that you need to go to the ER over, but it's something that your doctor can't see you, and it's urgent enough you need to get some treatment. So find that before your new policy becomes effective. Seventh thing is, have you met your out-of-pocket max on your old plan? Because if it changes over, say 1/1, make sure in December, if you need some additional services, make sure those things are done, because if you've already met that max out of pocket, everything that's approved services are 100%. So use it, because the worst thing is somebody go, man, I could have known that, I'd have scheduled that surgery in December because it wouldn't have cost me anything. Now it moves over into the new policy year. Now I got to meet my deductible out of pocket. So keep those things in mind. And the eighth thing is download that carrier app. Go back to you're not in the system when it first becomes, and you don't have the card. I know some of you got to have that card. If you don't have the card and your new policy becomes effective, if you download that carrier app and you type in your information and they pull you up in that app, guess what? You've got a digital ID card. So make sure you get that app, download it. So you go to the provider, everybody's got a phone, hit it, you show it to them. Also, it can show you what your benefits are right there. Nobody's going to carry around the benefit in their pocket. You got it on your phone, you know what your deductible, your copays are, your pharmacy copays. It'll even give you who's participating in the network. So those are great reasons and tips. If you're going to change your health insurance, keep those things in mind. Hope that was beneficial to you today on A Minute with Marty. You have a good day.